Hello guys, welcome back to our YouTube channel The Meds Vibe. So today we are going to learn about the wrist joint. The wrist joint is a synovial joint of the ellipsoid variety. The articular surfaces of the wrist joint include the inferior surface of the lower end of the radius, articular disc of the inferior radioulnar joint, the scaphoid, the triquetral and the lunate bones. The ligaments supporting the wrist joint are the articular capsule, the palmar and dorsal radiocarpal ligaments, the radial and ulnar collateral ligaments. Now let's understand each ligament in detail. First is the articular capsule. The articular capsule surrounds the joint. It is attached above to the lower end of radius and ulna and below to the proximal row of carpal bones. The palmar radiocarpal ligament is a broad band. The dorsal radiocarpal ligament is situated on the posterior side. The radial collateral ligament is attached to the styloid process of the radius to the scaphoid bone. The ulnar collateral ligament is attached to the styloid process of ulna to the triquetral and pisiform bones. The structures surrounding the wrist joint are anteriorly by the long flexure tendon with their synovial sheath and median nerve, posteriorly extensor tendons of the wrist and fingers with their synovial sheaths, and laterally by the radial artery. The blood supply of the wrist joint, it is supplied by the anterior and posterior carpal arches. The nerve supply of wrist joint is anterior and posterior interosseous nerves. It allows flexion, extension, abduction, adduction and circumduction movements. The clinical anatomy of the wrist joint. The wrist joint is commonly involved in rheumatoid arthritis. The back of the wrist is the common site for a ganglion. The wrist joint can be aspirated from the posterior surface between the tendons of the extensor pollicis longus and the extensor digitorum. So that's it for today guys. Thanks for watching. So don't forget to like, share and subscribe our channel.